His name was probably Robert, or Harold, or Walter, or Eugene. One of those names that belonged to a generation of men who built America with their hands and their backs, and their 40 years of showing up every single morning without complaint. He started working at the plant when he was 18, right out of high school. No college degree, no special training, just a strong back and a willingness to work hard and a handshake with the foreman on a Monday morning in 1930. And he worked. For 40 years he worked. The same plant, the same line, the same town. He bought a house. He raised 3 kids. He put them through school. He took a vacation every summer to a lake 2 states away. He drove a decent car. He went to church on Sundays. He coached Little League on Saturdays. And then, in 1970, at 65 years old, he retired. End quote. In days old. In days old. And days old. End quote. Just like that. He retired. No panic. No crisis. No spreadsheet. No financial advisor sitting across a mahogany desk telling him he hadn't saved enough. No terrifying calculation about whether the money would run out before he did. He retired. He got his pension check every month from the company he'd given 40 years to. He got his Social Security check. His house was paid off. His wife had Medicare. They had enough. Enough to live. Enough to be comfortable. Enough to help the grandkids occasionally. Enough to go to Florida in the winter because that's what you did when you retired and you'd earned it. He lived another 15 years. Good years. Comfortable years. Years where money was not the primary thing he thought about when he woke up in the morning. He died in his own home, with his family around him, cared for, secure, dignified. That story, that specific ordinary American story, is almost impossible today. Not rare, not difficult, almost impossible. Today, 1 in 5 Americans over the age of 65 is still working. Not because they want to, not because work gives them purpose and they can't imagine stopping, because they cannot afford to stop, because the money isn't there, because the pension doesn't exist, because Social Security isn't enough, because healthcare costs have made retirement a luxury that millions of ordinary Americans simply cannot access. We used to call it the golden years. Now we call it working until you drop. So, today, let's go back to 1970. Let's understand what it actually looked like when getting old in America wasn't a financial catastrophe, when a life of honest work actually paid off at the end, when retirement wasn't a privilege reserved for the lucky and the wealthy but a basic human right for anyone who showed up and did the work. Because what we've lost, it's not just money, it's the promise. The fundamental American promise that if you work hard and play by the rules, the end of your life will be okay. That promise is broken, completely and thoroughly broken. And we need to talk about how it happened. Okay, so, 1970. Let me set the scene properly. America in 1970 is complicated. Vietnam is still happening. Nixon is in the White House. The counterculture is in full swing. It's not a simple or peaceful time, but underneath all of that, the economic foundation for ordinary working Americans is still solid. Still fundamentally sound in a way that it hasn't been since. The average household income in 1970 is about $9,800 per year. In today's money, roughly $75,000 to $80,000. And here's the important thing. That income comes with something that most workers today will never have. A pension. Let me talk about pensions for a moment, because I think a lot of younger people have never actually experienced one and don't fully understand what they were. What they meant. What they gave to working people. A pension was a promise. A contractual, legally binding promise from your employer. You work for us for 30, 35, 40 years, and when you retire, we will pay you a monthly check for the rest of your life. Not a lump sum. Not a 401k that rises and falls with the stock market. A check. You didn't have to manage it. You didn't have to make investment decisions. You didn't have to worry about market crashes wiping out your savings 3 years before you planned to retire. You just showed up and did your job for decades, and the check came every month until you died. In 1970, about 50% of private sector workers had a pension. Half of all working Americans had a guaranteed income waiting for them at retirement regardless of what the stock market did or what happened to the economy. Today, less than 15% of private sector workers have a pension. We went from half to 15%, and that 15% is mostly older workers. For people entering the workforce today, pensions are essentially extinct. A historical artifact, something your grandparents had, gone. Now, let's talk about Social Security. Because in 1970, Social Security actually worked the way it was supposed to. You paid into it your whole working life. And when you retired at 65, it paid you back. Not a fortune, but enough to live on. Especially combined with a pension. Together, pension plus Social Security. Most working Americans in 1970 had a retirement income that covered their basic needs. And here's something important. In 1970, the ratio of workers paying into Social Security to retirees drawing from it was about 5 to 1. 5 workers supporting every one retiree. The math worked comfortably. The system was genuinely sustainable. Today, that ratio is about 3 to 1 and falling. As the baby boom generation retires in massive numbers, fewer and fewer workers are supporting more and more retirees. The math is getting harder. The system is under real pressure, and the retirement age has gone up. In 1970, full Social Security benefits kicked in at 65. Today, for most workers, full benefits don't kick in until 67. And there is serious pressure to raise it higher. 70. Maybe more. In 1970, you worked hard your whole life and retired at 65. Today, you work hard your whole life and retire at whenever you can afford to, which, for many Americans, is never. Let's talk about healthcare, because this is where things get really devastating. In 1970, Medicare had been around for 5 years. It was created in 1965 under Lyndon Johnson, and in 1970, it genuinely covered most of what elderly Americans needed. Doctor visits, hospital stays, basic medical care, not everything, but most of the important things, and the cost of healthcare in 1970 was manageable. A doctor's visit cost about $5. A day in the hospital cost maybe $60. Prescription drugs were inexpensive. The whole system was cheaper because healthcare hadn't yet become the multi-trillion-dollar extraction machine it is today. So, a retired couple in 1970, their out-of-pocket healthcare costs for the year might be a few $100s, maybe $500, manageable on a fixed retirement income. Today, Fidelity estimates that the average 65-year-old couple will need $315,000 in savings just to cover healthcare costs in retirement. Not housing, not food, not transportation, just healthcare. $315,000 just for medical bills. For a retirement that might last 20 or 25 years, and that number doesn't include long-term care, assisted living, nursing home costs. That's separate, and those costs are, hold on, let me give you this number properly because it needs to sink in. The average cost of a private room in a nursing home in America today is $108,000 per year. $108,000 per year. For one person, in 1970, a nursing home cost about $50 per month. $50 per month. Let that ratio sit with you for a moment. $50 per month in 1970. $9,000 per month today. The same service. The same basic human need. An old person needing care. The cost has multiplied by 180 times. Now, let's talk about housing. Because for most working Americans in 1970, retirement worked partly because the house was paid off. You bought your house in your late 20s or early 30s. Your mortgage was 20 or 25 years. By the time you retired at 65, the house was yours. Free and clear. No mortgage payment, no rent. You lived in your paid-off home on your pension and Social Security, and the math actually worked. In 1970, the average home price was about $23,000. The average worker made about $9,800 per year. That's about 2.5 years of salary for a house. You could get a 30-year mortgage at a modest interest rate, and your monthly payment was very manageable relative to your income. Today, the average home price is $420,000. The average worker makes about $60,000 per year. That's 7 years of salary for a house, and the interest rates and monthly payments relative to income are crushing. What that means for retirement is devastating. Millions of Americans today will reach retirement age still paying a mortgage, or still renting, because they couldn't afford to buy, or they bought late, or they bought and lost the house in the 2008 crash, or they moved to an expensive city for work and housing costs consumed everything. The paid-off house that anchored retirement security for the working class in 1970, millions of Americans today will never have it. Let me give you a direct comparison. Side by side. Real numbers. Retiring in 1970. Factory worker. 40 years of service. Monthly pension check. $400. In today's dollars, roughly $3,000. Monthly Social Security. $200. In today's dollars, roughly $1,500. Combined monthly retirement income, $600. Today's equivalent, about $4,500. Monthly housing cost, 0. House paid off. Monthly healthcare out of pocket, roughly $40. Monthly total expenses, roughly $300 to $350. Comfortable, genuinely comfortable. Money left over every month. Vacations, Christmas presents for grandkids. Dignity, retiring today. Worker, 40 years of service. No pension. Monthly social security, $1,800 average. Monthly 401k withdrawal. Depends entirely on how markets performed and how much you manage to save. For most Americans, the 401k balance at retirement is dangerously low. The median 401k balance for Americans nearing retirement is about $87,000. That's the median. Half have less. At a safe withdrawal rate, $87,000 generates about $300 per month. So most Americans retiring today have Social Security plus maybe $300 from savings. $2,100 per month. Monthly housing cost, $1,200 to $2,000 if still renting or carrying a mortgage. Monthly healthcare out of pocket, $500 to $800. Monthly food and basics, $500 to $700. The math doesn't work. It simply doesn't work. The money runs out. And what do you do when the money runs out and you're 73 years old? You go back to work. Have you been to a McDonald's lately? A Walmart? A CVS? Look at who's working there. Look carefully. You'll see them. Older faces. 70s. Sometimes. A woman who should be home with her grandchildren working a cash register. A man who should be retired greeting customers at the door. Not because they love the work, because they have to, because the money ran out or was never there in the first place. This is not rare. This is not unusual. This is millions of Americans. Working jobs they never imagined. Working at ages they never imagined working. In 1970, you retired, and you didn't go back. The chapter was over. A new one began. Rest, family, travel, whatever you wanted, with whatever time remained. Today, retirement is a revolving door. You retire, and then unretire because you can't afford not to. You go back to work, part-time, full-time, whatever you can find, whatever will take you. We have created an economy that uses people up and then abandons them. 40 years of your labor, your health, your time, and at the end, not enough. Never enough. Now, let's talk about something that nobody really discusses openly, the loneliness. In 1970, when you retired into a community, your neighborhood, your church, your friends who had also just retired, your extended family who hadn't moved across the country for jobs because the jobs were here, in this town, where everyone had always been. The social infrastructure of retirement in 1970 was rich. Neighbors who had known you for 30 years, a community that recognized you, organizations and clubs and churches where you had a place, people who noticed if you didn't show up. Today, retirement often means profound isolation. The neighborhood has changed, the neighbors have moved, the church attendance has declined, the friends have scattered. The children live in different cities, sometimes different time zones. The extended family network that used to surround elderly people like a safety net, it has dispersed. And without that community, without that human connection, the golden years become something else, something darker, something lonelier. Studies on loneliness in elderly Americans are consistent and heartbreaking. 1 in 3 Americans over 65 reports being seriously lonely. The health consequences of that loneliness are equivalent to smoking 15 cigarettes a day. Loneliness kills. Slowly, quietly, invisibly. But it kills. In 1970, Robert or Harold or Walter retired into the community he'd spent his whole life building. People knew his name. People checked on him. People brought food when he was sick. Today, an elderly person can go weeks without meaningful human contact. In a country of 330 million people, surrounded by more communication technology than any civilization in history, people are dying alone. Something has gone catastrophically wrong. Let me tell you about a woman I read about recently. 71 years old, retired school teacher, taught for 32 years, loved her students, loved her work. She had a modest pension from the school district and Social Security. She thought she had planned well. Then her husband died, and with him went his Social Security check. Half their income, gone overnight. Then her health started declining. medications, doctor visits, specialist appointments, things Medicare doesn't fully cover. The bills started coming. She sold her house to pay for an assisted living facility. Moved into a small room. The money from the house lasted 3 years. Then it was gone. She is now on Medicaid, which means the state is paying for her care, which means she had to spend down essentially everything she had ever saved or owned before qualifying for help. The system requires you to be essentially destitute before it will assist you. A woman who taught children for 32 years, who paid her taxes, who did everything right, who planned, ended up in a small room with nothing. That is not a rare story. That is happening everywhere, every day, to people who did everything they were supposed to do. So, what happened? How did we get from Robert's comfortable retirement in 1970 to this? Let me explain it clearly. First, the pension was killed, not by accident, by deliberate policy choice. In 1978, a small provision was added to the tax code, Section 401K. It was originally designed as a supplement to pensions, a way for executives to defer some compensation for tax purposes. Nobody really intended it to replace the pension system, but corporations saw an opportunity. A pension is an obligation, a guaranteed monthly payment to every retired employee for life. That's expensive. That's a liability on the balance sheet. A 401K puts the obligation on the worker. You save, you invest, you manage, you bear the risk. If the market crashes the year before you retire, that's your problem, not ours. So corporations, one by one, decade by decade, froze their pension plans and replaced them with 401K plans. They called it empowering workers, giving them control of their retirement. What it actually was transferring the risk from corporations to workers, eliminating a guaranteed benefit and replacing it with a hope and a prayer that the stock market cooperates. And for most workers, it didn't work. And neither cars, because saving enough in a 401K to fund a 20 or 25-year retirement requires discipline and income and financial literacy and time and a cooperating stock market. Most workers don't have all of those things simultaneously for 40 years. Life gets in the way. Medical bills, job losses, family crises. The money gets touched. The market crashes. The plan falls apart. The pension worked for Robert because Robert didn't have to manage it. The company managed it. Robert just showed up. The pension was guaranteed regardless of what happened in the market or in Robert's personal finances. The 401K put all of that on Robert, and most Roberts failed. Not because they were bad or irresponsible, because it was too much to ask. You cannot expect ordinary people to make sophisticated investment decisions that determine whether they will eat in their old age. That is not empowerment. That is abandonment. Second, healthcare costs exploded. We have talked about this in other videos. But in the context of retirement, it becomes especially devastating. Healthcare costs are highest in old age. That is simply biological reality. Older bodies need more care, more medications, more procedures, more support. In an economy where healthcare is a for-profit industry, where every hospital stay, every procedure, every prescription is an opportunity to extract revenue, the people who need healthcare most are also the people most vulnerable to being financially destroyed by its cost. Medicare helps. But Medicare has gaps, significant gaps. Prescription drugs, dental care, vision care, long-term care, all the things that older people need most are either not covered or inadequately covered by Medicare, and the supplemental insurance to fill those gaps costs money. Money that competes with food, with rent, with everything else on a fixed retirement income. The healthcare system was designed to profit from illness, and it does, effectively and thoroughly. And the people it profits from most are the elderly, the most vulnerable, the least able to fight back. Third, housing became unaffordable. We have talked about this too. But here is the specific retirement dimension. For retirement math to work the way it worked in 1970, you need a paid-off house by the time you retire. That was the foundation. No housing cost, just taxes and maintenance. Pension and Social Security covered the rest. When housing prices rose to the point where buying in your late 20s became impossible, when people started buying in their late 30s and 40s, the mortgage timeline extended. You're 65 and still have 10 years of mortgage payments left. Or you never bought. You're renting at 65 and retirement math is completely broken. And the equity. The home equity that used to be a backstop The thing you could sell if everything else failed. In expensive housing markets, that equity often went to the kids who inherited it, not to retirement. Or it was already cashed out to pay for the kids' education or a medical crisis or just to survive. The foundation crumbled. And without the foundation, the whole retirement structure collapsed. Fourth, the social safety net was deliberately weakened. In 1970, the idea that government had a responsibility to ensure that people who had worked their whole lives could retire with dignity was widely accepted. Not universally, but widely. It was considered basic civilized behavior for a wealthy society. Over the following decades, that idea was attacked. Systematically and effectively. Government programs are wasteful. The free market is more efficient. Personal responsibility. Individual choice. These are the values we should build around. And, slowly, the programs were weakened. The benefits were reduced. The eligibility requirements were tightened. The retirement age went up. The Social Security formula was adjusted in ways that reduced benefits over time. Each individual change was small. A tweak here, an adjustment there. Nobody voted to eliminate retirement security. They just voted for small changes, one at a time, year after year. And the accumulation of those small changes, over 50 years, amounts to a fundamental restructuring of who bears the risk of old age in America. In 1970, society bore a significant portion of that risk through pensions, through Social Security, through Medicare, through a shared commitment to the idea that people who worked hard deserved security at the end. Today, you bear that risk alone, entirely, personally, and if you fail to accumulate enough wealth to support yourself through potentially 30 years of retirement while simultaneously paying for healthcare that can cost hundreds of thousands of dollars, that is your problem, your failure, your responsibility, that shift. That fundamental shift from shared risk to individual risk. That is what happened between 1970 and today. Let me say something about what this does to people psychologically, not just financially. In 1970, a working man could look at his life and see a clear arc. You work, you contribute, you build something, you raise a family, and at the end, there is rest, there is reward, there is the knowledge that your years of effort were worth something, that the system recognized your contribution and gave you something back. That arc gave life meaning. It gave work meaning. It gave sacrifice meaning. Today, that arc is broken. You work, you contribute, you sacrifice, and you look at the end of the road and you see more work, indefinitely, until you can't anymore, until your body gives out, until someone else makes the decision for you. That's not just economically devastating. It's existentially devastating. It removes the meaning from the sacrifice. It breaks the implicit contract between a worker and his society. Why am I working this hard if there's no rest at the end? Why am I saving and sacrificing if it's never going to be enough? Why am I playing by the rules if the rules were changed after I already started playing? These are not lazy questions. These are not selfish questions. These are the questions of people who were promised something and had the promise broken. And the despair that comes from that broken promise. You can see it everywhere. In the faces of elderly people who are still working jobs they never imagined working. In the anxiety of middle-aged workers who are starting to do the math and realizing it doesn't add up. In the quiet resignation of young workers who have decided not to bother saving because the goal seems so impossibly far away. We broke something fundamental. And the damage isn't just financial. Now, I want to acknowledge something. Because fairness requires it. Life expectancy in 1970 was about 70 years. Today it's about 77. People are living longer. That's genuinely good. But longer lives require more retirement savings. The math gets harder with every additional year of life. And medical science has advanced. We can treat diseases today that were death sentences in 1970. We can extend life and improve quality of life in ways that are genuinely miraculous. But that medical miracle is expensive. Some of the healthcare costs that feel crushing are the price of treatments that simply didn't exist before. And women. Women in 1970 who stayed home didn't build their own retirement security. They were entirely dependent on their husbands. If the husband died, if the husband left, their financial security vanished. Today, women build their own careers and their own retirement savings. That is better, genuinely better, more equitable, more fair. So I'm not saying everything about 1970 was better. Some things are genuinely improved. But here is the thing. The improvements in medicine, the longer lifespans, the greater equality, None of those things require the retirement system to be as broken as it is. Other countries have longer lifespans than America, better health outcomes, more gender equality in the workforce, and they have stronger retirement systems, more universal pension coverage, lower healthcare costs in retirement, more generous social insurance. The brokenness of American retirement is not inevitable. It is not the price of progress. It is a choice, a specific, political, economic choice that benefited some people enormously at the expense of millions of ordinary workers. Different choices are possible, so what can actually change? Because I'm not going to just make you angry and leave. That's not useful. Not for again. Dig in. Not for again. Strengthen Social Security. This is the most direct lever, raising the cap on Social Security taxes so that higher earners pay more into the system, adjusting the benefit formula to be more generous for lower-income workers, protecting it from cuts. These are policy choices that can be made. Bring back the pension. Not exactly as it was, but the principle. Guaranteed retirement income, not dependent on stock market performance. Some states and some industries have done this. It can be expanded. Fix long-term care. This is the most devastating gap in the current system. Nursing home costs destroy families. A serious long-term care insurance program, either public or with strong public subsidy, could change this fundamentally. Other countries have this. We can too. Make Medicare more comprehensive. Dental, vision, hearing, prescription drug costs that don't bankrupt people. These are not luxuries. They are basic healthcare needs of elderly people. A wealthy country can afford to cover them. Reform housing. We have talked about this before, but the retirement dimension is critical. Policies that make home ownership accessible in your 20s and 30s are also retirement policies, because the paid-off house is still the foundation of retirement security for most working people. And build community. This is the hardest one. You can't legislate community, but you can choose it. Know your elderly neighbors. Check on them. Include them. Build the kind of community where people are not invisible just because they are old. The loneliness is killing people as surely as the financial stress. And this one is something each of us can actually do right now. In 1970, Robert worked for 40 years and retired with dignity. A pension check every month. Social Security. Medicare. A paid-off house. A community that knew his name. Grandchildren nearby. Enough money. Enough connection. Enough rest. He had earned it. He had paid for it with 40 years of his life. And the society he had built that life in honored the debt. Today, millions of Americans work 40 years and get not enough. Never quite enough. The debt is never fully honored. The promise is never quite kept. And so they keep working. Past 65, past 70, until the body says no, until the job disappears, until the choice is made for them. That is not golden years. That is not the reward for a life of honest work. That is a society that decided somewhere along the way that the profit of corporations mattered more than the dignity of workers. That individual responsibility meant abandoning people who could no longer be economically productive. That old age was a personal financial problem rather than a shared human reality. We can do better. We have done better. Within living memory, we did better. And we owe it to everyone who is going to grow old, which is all of us, if we're lucky, to find our way back to something that works, something that keeps the promise, something worthy of the 40 years. Thanks for watching. If this one meant something to you, share it. Someone out there needs to hear this today. See you in the next one.